Hello, everyone. I'm Dr. Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'm going to be going over some key concepts of environmental health. Of course, tomorrow happens to be World Environment Day, and I've designed and done a lot of research in environmental health. So I decided that I was going to make this video kind of summarizing a lot of the concepts that I've learned over the years. I do have a registered environmental health specialist certification, which is a very competitive sort of certification to get. And so a lot of the knowledge I've amassed is by also reading certain books to prepare for that exam. So let's go and get started. Wanted to start off by, I created this, I wanted to get started off by looking at some of the factors that allow for environmental health to be the health of the individual being affected by the environment. So this can be, and this can be physical, chemical, biological, or built environment. So these are, if you think about the chronic diseases, a lot of those chronic diseases like diabetes, cardiovascular disease are influenced by the environment. So here's the environment. Here's some of the exposure pathways, which are air, water, soil, food, or consumer goods. So a lot of times there's recalls and things like that. Like currently there's a recall on frozen pizza. I think salmonella in there. So there's a lot of exposure pathways, and then human exposure, inhalation, ingestion, and dermal contact. So if you think about certain things in the environment that are allergic, give you allergic reactions, then that could be a source of human exposure that causes health ailments. And then you have the health effects. So what are some of the, like I was telling you previously, some of the health effects include acute illness, chronic disease, injury, and developmental impact. So I actually reside next to 3 Mile Island, about 40, 50 minutes from here. And there has been a higher incidence of certain cancers among people that were living here. A lot of times, the impact of environmental health is felt a lot later than the exposure happens. So a lot of times there's no way of telling where it came from. But when you see a general increase within the population of certain cancers, then you know that the nuclear disaster is what caused it. So 3 Mile Island, just to give you a little bit of background, there were two reactors that overheated, and so the overheating caused some of the nuclear waste to be released into the air. And so this didn't take place for too long, but just a little bit has a huge impact among the people living around there. So public health actions, one is monitoring, regulation, mitigation, and education. So a lot of the wastes are buried, some of the toxic wastes are buried under the ground in big drums. And a lot of times the seal goes away. And so the toxic waste is released perhaps in the water system under the ground or even above the ground. So these are kind of the facets of environmental health that is important to note. This is a visual that was created by the World Health Organization, and it says how the environment impacts our health. So people are exposed to risk factors in their homes, workplaces, and communities through air pollution, inadequate water, sanitation, chemicals, radiation, and I've talked about radiation a lot from different aspects, but this is radiation from ultraviolet and ionizing radiation. And then community noise, that's big. Occupational risks, agriculture practices, built environments, and climate change. So these are all areas to keep in mind, about 9 areas to keep in mind when you're thinking about environmental health. So this is all for now for environmental health. I hope this has made some sense. Thank you for listening.